There are measles outbreaks in at least 5 states that I can recall, and Kentucky's governor admitted he exposed his kids to chickenpox rather than getting them vaccinated, causing quite the hubbub on social media and in the news. So what in the heck is going on here? Dr. Gary Marshall is a U of L pediatrician who has produced an app for vaccines and has strong opinions about them. Gary, welcome back to the show.
Thank you.
Good to see you.
Thanks for having me.
What the heck is going on? I mean, all of a sudden, out of the blue, we start hearing about the anti-vaxxers and parents not wanting to vaccinate their kids and measles outbreaks. Is there just a change in the social fabric of America that parents aren't doing this, or what's going on out there?
Yeah, your guess is as good as mine. It's kind of hard to believe that almost 2 decades after measles was eliminated from the United States, we're now seeing outbreaks and cases again. In fact, we're on track to have more cases of measles in the U.S. this year than we've had since measles was eliminated, which was in the year 2000.
Oh, that's a long time. 19 years then, right? Is that when the MMR vaccine came on?
MMR, we've actually had a measles vaccine since 1963, and then we've had an MMR vaccine since 1971. So we've had the vaccine. It's safe. It's recommended for all children. And the problem is that there are some parents who are not getting their kids vaccinated. So it's some ways it's not rocket science that we're seeing outbreaks. The other thing is that oftentimes the unvaccinated children tend to cluster in the same geographic region. And so you have a lot of susceptibles, and all it takes is for the importation of a case, and there you go. You have an outbreak. And Mark, it's really sad to me that there are so many people who are misled into thinking that the vaccine is more dangerous than the disease, because I've seen the disease. Those of a certain age have seen it, and I've seen it in my own medical career. There was an outbreak in Philadelphia in 1989 when I was in training there. It's a terrible disease. And it's not just the acute morbidity where you have fevers and rash and et cetera, but 1 or 2 in 1,000 kids will die from the infection, or they'll get encephalitis. And some of them will even go on many years later to have a long-term complication that leads to death, which is called SSPE. So it makes no sense that we can prevent this disease, and there are people who intentionally leave their children vulnerable to the disease.
Well, you know what some of the parents are saying out there is that for religious reasons, I'm not going to have my kids get vaccinated. Is that a legitimate reason for you?
Which religion is that? I don't know of too many religions that espouse as a theological tenet that children should get sick and suffer and die from diseases when that can be prevented. So, and the truth is, there really is no mainstream religion that has that belief. In fact, you'd argue just the opposite, right? That we're taught to care for our children and to care for each other, and that by being vaccinated, we're doing that. We actually are preventing disease among the people we live with.
Talking with Dr. Gary Marshall, who's a U of L pediatrician and teaches classes at the University of Louisville as well. Let's talk about the measles outbreak, then we'll get into chickenpox, the flu, some other things. But the measles outbreak, I think, as I mentioned in the open there, I think there's 5 states that have had some form of an outbreak, right? Does that sound
19 cases where measles has now been reported, including Kentucky.
Right. But in terms of an outbreak where you have several cases, there are pockets, like in Washington State, I think, New York City.
Yes.
And in each of those, they were kids that went overseas for the most part, right? And came back, had not been vaccinated in the United States, came back and infected other kids. Is that essentially it?
So this is, it's kind of confusing when we say that measles was eliminated from the United States in 2000. And in fact, in 2016 was eliminated from the entire region of the Americas. So how can we still see cases if it's been eliminated?
Good question.
That's really kind of an epidemiological distinction. So elimination means there are not successive waves of transmission, like concentric rings of spread of the disease. And it happens when you don't have enough immune people in the population. So we still see cases because those, as you point out, can be imported from places where measles is still endemic. But those outbreaks are relatively contained because a few susceptibles get sick, but then it doesn't spread out further into the community.
Because everybody else has been inoculated.
Yes. And so when you get into places like Washington State or Oregon, or there's a county up in New York State where many of the children are not vaccinated, that's when you have trouble, because that's when that virus will spread. It's one of the most contagious diseases that is known to man.
Measles?
And yes,
Did
absolutely.
not know that. Okay.
The attack rate is 90% in households. If there's a case and there's a susceptible person living in the household, 90% chance that person will get the disease.
Wow.
Just like chickenpox.
Is it airborne and sticks around? Is
That's
that the
right.
deal? Okay.
Yeah. Uh-huh.
So all you got to do is sneeze once, and it's out there in the air and hangs around the living room for a while.
Floats around in the air, and in fact, there's for chickenpox, for example, there's well-documented cases where it literally floats down the hallway, like in a hospital or in a clinic.
Talk about Dr. Gary Marshall, U of L pediatrician. Is there a chance that this could happen in Kentucky and southern Indiana?
Measles outbreak?
Mm-hmm.
Well, I don't know offhand what our MMR vaccination rates are. I mean, they're very good, but there is a small percentage of people in across the country who are not immunizing, and I don't think we'll see an outbreak unless measles virus lands in a community where there are a lot of people who are unvaccinated. This actually happened not far up the road in Indiana in 2005, where there was a church community that, for some reason, many of the parents in that church community decided not to vaccinate their children. It had nothing to do with the church or the religion or anything. It's just that they, I guess, convinced each other this was the right path to take. One of the kids went over to Eastern Europe for a mission trip, got measles, came back contagious for measles, spread it throughout the church. And there were 30 or 35 people who got sick. Many were hospitalized, some in the ICU. So the point is, if that child had come back to a community where everyone was vaccinated, she would have been sick, but no one else would have gotten sick. But when you have a lot of susceptibles in one place, it's a problem.
Are there any, I mean, we've seen some of the discounted studies that were done and the papers that were out there about some of these vaccines. Is there any chance that any of these vaccines could cause autism or any, internal problems for children if you're given the vaccine, or are you absolutely convinced there's no danger to any of these vaccines?
Well, I mean, to say there's no danger is like saying there's no danger in me walking out of this studio onto Cardinal Boulevard, right? There is a danger. Somebody could be, what do they do, skateboarding down the thing and knock me over. So everything, there's risks in everything. So I would be lying to you if I said there was no risk, absolutely no risk in vaccination. Of course there is some risk. You can have an allergic reaction. Fortunately, it only happens 1 in a million times. You could get a little fever or a rash from MMR. You can get a sore arm. But autism, no. When are we going to stop asking this question? Okay, it's been asked for 20 years now. There are studies that involve of literally tens of millions of children that show no relationship between these vaccines and autism. Autism will turn out to be something related to the genes that are expressed in the developing brain in utero, and I think we're actually getting closer to understanding that.
Again, we're talking with Dr. Gary Marshall, who's a U of L pediatrician and specializes a little bit, anyways, in vaccinations. Didn't you do an app or wrote a book or something about?
Right. I have a book called The Vaccine Handbook, which is actually we call the Purple Book, but it's now going into its 8th edition, so it's been out since 2004. And it is also available as an app, which is free. So if you have an iOS device, you can download it and read it.
So if you're a parent who has questions about vaccinating your kids, they can go to this app, and it's called what?
It's called The Vaccine Handbook. So the book is really geared towards providers,
but doctors.
But it's written in normal human language.
I can read it and understand it. Is
Even
that what you're
you
trying to say,
could understand it. And Chapter 7 is the largest chapter in the book, and it's all about addressing the concerns that parents have. We had a child that was hospitalized not long ago for meningitis, and it was a baby who had not been immunized. These were wonderful parents, really intelligent, and after she recovered, which fortunately she did, and she had a form of meningitis that could have been prevented by vaccinations, they basically said, "We're so sorry we didn't immunize our child. We could have prevented this." And I basically told them, look, in some ways you're the victim because you were victimized by the misinformation that you read on the internet or on Facebook or whatever it is. And I understand how you can be misled that way. But in that sense, you're the victim, and your child was a victim of that.
Yeah. All right, let's move on to the chicken pox now, because you got a couple things going on in Kentucky. One, you had a governor who said he didn't vaccinate his kids and he exposed them to the chicken pox rather than vaccinate them. That was number one. Then number two, you had up in northern Kentucky, the Northern Kentucky Health Department said we are not going to let kids in school unless they've been vaccinated against chicken pox. And you now got a student at a Catholic school suing the Northern Kentucky Health Department, saying you can't do that. It's against my religious beliefs. So you got two things going on, throwing information out there that basically a chickenpox vaccine is not necessarily a good thing. What was your response when you saw those two different things?
Well, let me comment on those things separately. So, and this is kind of interesting that the case in Northern Kentucky really centered on one of the high school kids who is a star basketball player. Was unimmunized, and there is an outbreak at this school where there were first 6 and then 18 and then 32 cases of chickenpox, so spreading very quickly. And the health department is given a mandate by the law to protect the public. And so in pursuance of that mandate, they shut down the school, and then they also barred the athletes from competing around the state because they didn't want to spread the chickenpox elsewhere. And keep in mind, too, that it's not just unvaccinated people. There are kids who can't be vaccinated. So kids who have leukemia, who are in maintenance chemotherapy, or arthritis, who are on biologics, they cannot be vaccinated. So the only way they're protected is to have everyone around them immunized against chickenpox. So the state did not want other kids in the state to be exposed. And actually there was a hearing for a temporary restraining order last week, and the judge sided with the health department and said, no, the health department can prevent it.
They had the power to do that, yeah.
Interesting anecdote. Only in Kentucky would this be about basketball, right? But
well, some other state, Texas, it might be about football, so there you go.
And and then as far as so chickenpox parties, right? So
that's what they call them, chickenpox parties, where a bunch of parents get together and say, we're going to expose all our kids to chickenpox, right?
Right.
So that they can't get it in the future. Let's just do it under a controlled circumstance.
Really stupid thing to do, okay?
Could you tell us what you really think?
I'm going to tell you. It's really stupid, and I'll tell you why. First of all, I've seen children die from complications of chickenpox. Second of all, this is entirely preventable with the vaccine. So the vaccine program we have now, 2 doses in childhood, 98% effective in preventing chickenpox. And we've seen, used to be 4 million cases of chickenpox a year, 11,000 kids hospitalized, 100 people die every year of chickenpox. Since this program started, the number of deaths has gone down to a handful, and the number of cases hospitalized very, very small. But it's not just about preventing those complications of the disease. Well, first of all, it's about preventing the disease, which is a miserable disease, 200 to 500 itchy, open sores on your skin and fever and all of that. But beyond that, 1 million adults a year get shingles. And 20 or 30%, you've had it, there you go.
It was no fun.
I think that's a HIPAA violation. But so, and that is not fun. And a third of them go on to have pain in the spot on their skin for a month, and 10% go on to have pain for 3 months. That's called postherpetic neuralgia. It's a horrible disease, and the pain can be so bad that it's actually, there are suicides that have been linked to persistent.
Oh, it's awful. It feels like it's in your bones, I can tell you.
The only way you get shingles is if you have the chickenpox virus in your body, right? From childhood.
I did as a kid.
And I had chickenpox too as a kid, but fortunately I've gotten the shingles vaccine to prevent that. But the point is that you have 2 choices. You can be infected with the wild type virus, which is the stronger virus, the one that can live in your body forever and then come up as shingles later and cause this. Or you can get the vaccine, which also lives in your body, but much less likely to reactivate as shingles. So why would you take your kid and intentionally expose them to a disease that has all these complications and all this morbidity and the potential for them to get horrible shingles and PHN later in life? when it could be prevented with a vaccine.
Talking with Dr. Gary Marshall, U of L pediatrician, and a little bit of an expert on vaccinations. All right, so a couple more questions, and then we got to wrap this up. I want to ask about the flu vaccine. Any clue as to how effective the flu vaccine has been this season?
Well, it's been better this year than in the past year. Last year, and let me just say one thing. When you talk about effective, we define that in different ways, okay? So
it keeps me from getting the flu. that would be effective.
No, actually not.
Okay. Well, that's what I consider
That's why
effective.
you're a radio host and
That's
not
right.
a doctor, okay? So a vaccine can prevent the flu, but if it doesn't prevent the flu, what we hope is that it prevents you from getting really sick or dying or winding up in the hospital. So when you hear these efficacy numbers of 30%, 40%, that usually means it prevented the infection. But if you look at the efficacy against death and hospitalization, it's much higher than that.
Bottom line, if it helps to tone down the flu, you only have it for a couple of days instead of a week.
Exactly.
That means, in your mind, it worked.
Exactly.
Okay.
If we can prevent deaths, last year or the year before, something like 80,000 people died of the flu.
I know.
Okay?
Yep.
And I wish we had better vaccines, and we are working on that. Someday we will have a better flu vaccine, but for now, this is what we've got.
Last one, cervical cancer vaccine.
Oh, my goodness.
Why aren't more families having their daughters and their sons get the vaccine?
So more and more are. I can't answer for you why, but I'll tell you.
When you talk to your patients, what do they tell you? When you say, hey, you ought to get this vaccine, what do they say?
My child's not going to be exposed, which is not true.
My kid's not going to have sex?
Yes, and yes. So they
That's
don't
the
think
nuts and
they
bolts,
don't
right?
think that's going to. Yes,
Right.
exactly. But I just think, again, they're misled and they don't get it. This is a vaccine against cancer. More than 40,000 cancers every year caused by this virus, and 40% of those are in boys or men,
Right.
including oropharyngeal cancer. This vaccine is about 100% protective against the 9 types of HPV in the vaccine. So again, when I was in medical school, somebody came to me and said, hey, by the way, a couple of decades from now, we're going to have a vaccine prevents thousands of cancers. I would have said, oh, really? Yeah. Let me know when that happens. Well, it's happened. We have a vaccine
So get
against
the
cancer.
shot. Get your kids
the
the
shot.
for your
Absolutely.
cancer. Okay. All right. Gary, it's always great talking to you. Dr. Gary Marshall from the University of Louisville School of Medicine. He's a pediatrician at U of L, and they can reach you through ULP, right?
Yes.
University of Louisville Physicians. All right. Gary, as always, thanks for being on the show.